technical section. How does modern healthcare contribute to these problems? For a long time, sustainability was not something the healthcare sector thought much about. Some thought of healthcare as altruistic and assumed it didn't have much of a footprint. For others, asking healthcare to become more efficient was an affront to healthcare. An attitude persisted that healthcare shouldn't skimp when trying to save lives. Unfortunately, we know that our spending on US healthcare does not produce the desired outcomes. We spend far and above other developed countries on healthcare, and yet we have some of the worst outcomes. Healthcare, a major GHG emitter. As studies emerged looking at the environmental impact of healthcare, we have discovered that healthcare services actually generate a lot of emissions. Globally, healthcare is responsible for about 4.5% of greenhouse gases, more than the aviation sector. In the US, our outside spending parallels our greenhouse gases. US healthcare emits an estimated 8.5% of our country's GHGs. If US healthcare were a country, it would be the 13th largest emitter in the world. This diagram details U.S. national healthcare greenhouse gases by the Greenhouse Gas Protocol scopes, which were mentioned in the first topic, what is climate change? This diagram emphasizes how important Scope 3 emissions are to healthcare and how many opportunities there are to intervene. Healthcare emissions and biodiversity. As a service sector that uses most other sectors, healthcare is also responsible for many other environmental emissions. The practice of healthcare itself in the US causes significant pollution and consequently affects the health of our populations. This graph shows the environmental impacts of US healthcare activities over time, including increases in ozone depletion, particulate matter, and eutrophication. Plastics in healthcare. The healthcare industry produces a significant amount of plastic waste. It is also highly reliant on single-use plastics, or SUPs, most of which end up in a landfill. Healthcare is unique because SUPs have traditionally been associated with safety and more rigorous patient care, which means that the disposability of plastics is seen as inherently good. SUPs in healthcare include disposable personal protective equipment like masks, gowns, and gloves, syringes, IV bags, tubing, surgical drapes, and devices such as blood pressure cuffs, catheters, and complex surgical instruments. Since plastics have been linked to adverse health effects, the balance between public health and environmental sustainability must be refined. Populations who are most vulnerable include women and children, specifically babies in the NICU. Polyvinyl chloride, or PVC, and phthalates and other plasticizers are used in medical devices for respiratory support, transfusion, and nutrition. They have been associated with neurodevelopmental delays and reproductive disorders, and some are carcinogens. Specifically, PVC is widely used in healthcare. Up to 25% of all medical devices include PVC, and is particularly problematic due to the toxicity of chlorine production, difficulty in recycling, and necessary use of many additives to improve its performance. One study found that metabolites of these plastics are found in the urine of babies who stay in the NICU. Additionally, the use of SUPs in healthcare affect not only individuals who stay in the hospital, but also the health of their communities and the general public. In times of healthcare emergencies or crises, such as the COVID-19 pandemic, we have seen how the use of SUPs dramatically increases with mixed messaging and public confusion over whether reusable materials are allowed, especially in healthcare settings. Increases in plastic waste and improper waste management have led to an increase in plastic exposure over the 21st century, and this only leads to more negative impacts to our communities and the nature around us. Approaches have been proposed to stratify risk of SUP in healthcare depending on the specific SUP. One approach is called Pass Up, Pragmatic Approach to Streamlining Single-Use Plastics. In this model, each SUP is assessed on the basis of the degree of conflict posed to safety, effectiveness, and affordability on 3 levels: no conflict, context-dependent, and conflict. The table below outlines some common SUPs used in healthcare and their pass-up rating. Healthcare and humanity. Medical supply chains have also been found guilty of labor violations. Some news articles have reported that children as young as 12 are making surgical instruments in hazardous conditions in Pakistan. Dr. Mahmood Buddha, an NHS surgeon and founder of the British Medical Association's Medical Fair and Ethical Trade program, said, "For many of the instruments I use, I have no reliable way of ensuring they have not been made by children." Ethylene oxide, or ETO, is a common sterilizer in healthcare. It has also been on the federal list of carcinogens since 1985. There are around 50,000 medical devices that can only be sterilized using ETO, and at present there are no alternatives to ETO for sterilization of these devices. Other sterilization techniques are being explored, but more progress needs to be made, and quickly. ETO has made a splash in the news several times. For example, it has been found to be in waste products of different institutions, including Sterigenics in 2019, which has downstream effects on communities who live around these institutions.